Although phobias can affect both adults and children, research today has essentially revealed that specific phobias are more prone to developing during early childhood. However, these specific phobias are most often encountered through late childhood or even early adolescence. Because specific phobias are common, treatments have been developed to reduce or treat this type of anxiety disorder. Essentially, the talking point here is what treatments have been scientifically proven to be efficacious in reducing or treating specific phobias in children? So, the overview of this scholarly conversation basically explains one, the impact specific phobias have on children, two, potential treatments that may help reduce or treat this type of anxiety disorder, and three, the effectiveness each of the treatments have on children. In most cases, specific phobias can limit people's daily activities, which can eventually cause severe anxiety. Specific phobias are more likely to develop and worsen if triggers are persistent and excessive. Because of this, treatments such as psychotherapy, exposure therapy, and cognitive behavioral therapy, also known as CBT, have been developed in order to reduce or treat specific phobias. Um, Briefly, psychotherapy consists of basically talking with a mental health professional, such as therapists or psychologists, in order to help manage a person's specific phobia. Exposure therapies basically primarily reflect a variety of behavioral approaches that are essentially based on exposing the phobic individual to the stimuli that excessively frightens them. Whereas exposure therapy takes a more drastic change, CBT allows the phobic individual to gradually change what they think about their specific phobia. Regarding treatment effectiveness, research has revealed that both exposure therapy and CBT have higher success rates than psychotherapy. This is primarily because children are sometimes unable to communicate their experiences with their specific phobias. And as for the synthesis map, all the sources presented have five common categories. Each source practically consists of treatments that are broken down into procedures that essentially help reduce and treat specific phobias in children. Additionally, treatment outcomes are eventually written up in order to compose statistical success rates that provide the treatment effectiveness. How does this conversation address my question? So basically, this conversation supplies thorough and detailed information on a variety of treatments for specific phobia in children. Each of the information components within the sources acknowledge the concept of each of the treatments themselves. Additionally, the information components provide an overall general idea of the effectiveness each treatment supplies in the aid to decrease specific phobia within an individual. Although research reveals that exposure therapy and CBT's success rates are high, I would like to know whether these treatments are effective for every individual with specific phobias, or must they be tailored to an individual in order for the treatment itself to effectively work? So, moving toward the literature review, the sources I have selected are eminently informative and communicative because they provide information that essentially strictly addresses my research question. Additionally, one of the sources provides two prominent child cases that address specific phobias. Little Hans and Little Albert are both well known young boys who were involved in different specific phobia experiments within the psychology discourse community. As for next week, my plans are to essentially finalize my questions for the interview along with confirm my appointment with the professional in my psychology discourse community. And lastly, I plan to gather a few more sources to thoroughly address my research question. Moving forward, these treatments for specific phobias in children are reviewed and critiqued by the bioinformational theory, which reveals that these sources are research based data that will allow me to recommend efficacious treatments to patients I may assess in my career of psychology.